Richard Buckley, Milford MD. The noise in the background is our Pro Lipo laser. It's all tuned and ready to go for us. This morning's project is laser liposculpting of the neck. Our patient's awake, yes?
Yes.
And how's it been so far?
Great.
Amazing?
Amazing.
Good music?
Good music.
Amazing music, right? Yeah. And she's laughing, so she's comfortable. We're comfortable. And what we're going to do is some lasering of this front of the neck in order to get some tightening going. And then I'm going to suction out fat and also the part of the lasering where I've melted some fat. It tightens, it also melts fat. The whole idea is to get some of the fullness out of the neck and also to help crisp up the jawline. And the areas that need to be numbed, they're numbed. You can even see they're a little white looking because they have a substance epinephrine in them, which helps to minimize bruising. And a lot of times we do this and there's no bruising. This is not with any numbing nor with any epinephrine. You can see the numbing and the epinephrine start kind of where this white line is. And I'm going to be working from here to here and from here to here. Sea to shining sea. My laser fiber looks like this. This is a helium neon beam, which is a targeting beam. I have different lengths of cannulas holding the laser fiber, and I use different ones depending upon what I'm up to. This is the fiber itself. It's very thin. It's 1,000 microns, so it's a millimeter. Very, very thin. And so that in there, bring it out just a little bit, and we're good to go. Laser lipo this morning. This is the laser. That's the targeting beam, the uni beam, helium neon. I put that under the skin. I trigger it with my foot pedal, and now I'm lasering. You comfortable?
Yes.
Totally?
Completely.
Completely and totally comfortable. So I'm just going to keep doing this until I've put a suitable amount of joules of energy in the neck. Maybe as few as 3,000 joules sometimes, or maybe 5,000 joules. Today will probably be something between 4,000 and 5,000 joules. We're always monitoring temperature. First I can feel it with my hand. I can even feel it better with the back of my hand. And after I'm doing this for a bit, we'll start using an infrared temperature measuring gadget, and we'll monitor the skin temperature. We like to keep that not higher than 42 degrees centigrade. Thank you for watching MilfordMD Laser Liposculpting Neck. Richard Buckley, MilfordMD. Remember, this morning's project is laser liposculpting. You awake?
Yes.
Totally comfortable the whole
Yes.
time? Happy?
Yes.
Good music?
Yes.
Fun people?
Yes.
What could be better? And accomplishing your goal of sculpting the neck, right?
Yes.
One of the things you wanted was a crisper jawline. Working on that. We first did lasering, first numbed, then we did lasering. And now I have little tools, like that's a little cannula, that's a little poke hole. In the little poke hole, I can put my little tool and do some work. I have lots of little tools, all different lengths, different hole configurations for sucking. This one has a whole bunch of little holes. I put it in my little poke hole here, and it vibrates for me as well. And then as I move, fat is coming out here. I don't know if you can zoom in. You can see our fat coming out there. It only comes out as I move. If I don't move, it's not coming out. And just to show you that our holes are sort of connected, that's a little poke hole that I have under the chin. There's a third one on the other side that we'll use in a minute. So that's laser suctioning. Richard Buckley, MilfordMD. Remember I said we were doing laser liposculpting this morning of the neck. We did the lasering, and some fat melted with that process, and also there was tightening. I started doing the liposuctioning now, and I'm suctioning out whatever fat I've melted plus some additional fat cells. I think you can see here I've started the suctioning in this area with my little tool, my little vibrating tool. Here is more full here is starting to get sculpted out. This jawline is getting chiseled. Maybe just walk it around and see if you can't keep tight and zoomed in. Maybe an angle here. See if you can show that that's coming in very nicely. This is still poofed out. Thank you for watching Milford MD. Looks nice.